Awesome. Let's go ahead and get started, and I'm sure others are going to continue joining throughout the presentation. So my name is Christian Sosa. I'm the program manager for the Donald M. Payne International Development Fellowship Program. Thank you for coming to day 2 of Backstop Week, where we're going to be focusing on public health. The Backstop is officially called Population Health and Nutrition, but we might be using public health, global health, just health officer, just as a preface if we're using all these different words. Just for some house rules for the event. As a reminder, it is going to be recorded. So if you do not want to show up on camera, just keep your camera off. Otherwise, we're happy to have this be a resource for you in the future, as well as for any other applicants that might be interested in public or global health. If you have any questions throughout the presentation, feel free to use the chat function throughout the presentation, type it in. We'll make sure to get to it towards the end. And we will be having a Q&A at the end where you are able or welcome to come off mute and ask your question vocally. I just ask that you use the raise hand function so we have a little bit of order in terms of making sure that people aren't talking over each other. I'm going to assume that you have at least a base level knowledge of USAID or of the Payne Fellowship. So I'm going to cover the Payne Fellowship and go over the selection process and all these great things that you probably have some questions on. But the bulk of this day is going to be focused on public health. And we have 3 excellent Payne alumni that are going to be able to share their experience as well. So without further ado, let's go ahead and get started. So the Payne Fellowship, as many of you know, is funded by USAID and was founded in 2012 with the goal of identifying and developing members of diverse and historically underrepresented groups for a career in the Foreign Service. So in order to provide some context over what we mean by diversity, we're looking at that in several different ways. So of course, we're looking at that as racial and ethnic minorities, getting more diversity on that front. We're looking at gender diversity. We're looking at socioeconomic diversity. We're also looking at geographic diversity. As you can imagine, the Foreign Service within USAID and State Department has been very traditionally white, old, male, and coastal. So we're trying to make sure that the Foreign Service within USAID is going to better reflect American population as a whole, looking at all the wonderful colors, all the wonderful experiences that we have in this country. So it is funded by USAID and therefore leads to a career in the Foreign Service with USAID specifically and managed by Howard University. All that means is we have the honor of running the program on behalf of USAID, but you do not need to go to a Howard University. You don't have to be a Howard student, nor do you need to go to a Howard program to be eligible. You just get to work with Howard during the 2 years during your fellowship. And of course, it's named in honor of the late Congressman Donald M. Payne Sr. So Congressman Payne Sr. Was the first African-American congressman voted in New Jersey, and he had a very long-standing legacy of promoting human rights and humanitarian aid. He was truly, as Administrator Power called him this morning, a quiet storm, very calming presence, but super big advocate for these rights. And so the program was founded in 2012 in order to honor his legacy and create that Foreign Service that is going to be more reflective of the American population. So on to the Payne Graduate Fellowship itself. Again, I'm going to assume that you have at least some knowledge of this, but the Payne Fellowship awards funding of up to $90,000 over the 2 years to cover tuition, fees, living expenses, and your 2 summer internships. So I'm just going to break that down a little bit. So $20,000 from that $96,000 is allocated for your tuition and fees. That tranche of money is paid directly to the graduate program of your choice. So they bill us, we pay you. You don't have to worry about at least $20,000 of your graduate school cost. As you can imagine, some graduate programs are significantly more than that $20,000 because of the rising cost of graduate school. But we're lucky that we have a growing number of graduate programs that have partnered with us to provide supplemental financial assistance to Payne Fellows, and in some cases, even a Payne finalist. That list is available on our website. We do have a good number of public health programs that have partnered with us, but you're not restricted to that list, right? If you go to one of our graduate partners, you could end up having a pretty good financial aid package, but there might be programs that are more interesting to you, or maybe you're interested in a specific area in public health that is not partnered with us. Certainly, you're welcome to go to those programs as long as it meets our 4 basic requirements, which I'm going to cover in the next slide. For graduate programs, you're welcome to go to those programs. So $16,000 of your total financial package with the Payne Fellowship is allocated for you as a living stipend. This is paid directly to you as a fellow to help offset the cost of living in whatever city you are in. So most fellows use this for rent, books, school supplies, maybe a laptop if you need it. You're certainly able to use it on whatever you'd like. Do I recommend spending it on a new car or spending it all at once? No, but you are welcome to use it however you'd like. And it's money that's given directly to you as a benefit for this program. $10,000 each summer are allocated to your 2 summer internships. The first summer internship takes place before you start graduate school, and that's going to be on Capitol Hill. We're going to take care of the placements, hopefully placing you with your own member of Congress or congressman working on specific international development issues. Then the second internship is going to be overseas at a USAID mission. And again, we'll take care of the placements, the travel, the housing. You're just responsible for having a great time and having that exposure and that experience to the future lifestyle that you're signing up for. So in terms of the selection process and the timeline of being selected as a Payne Fellow, I'll start with the selection process itself. Our application includes several components, including your academic background. So we're asking you to provide information on any schooling you've had, college level schooling, up until the application. So that includes if you've gone to a community college and then transferred to a 4-year institution, we'd like to see a transcript from both of those areas. Think and look at whatever transcripts you have, right? So if you've studied abroad, transferred credits or whatnot, we need to see a letter grade associated with any of those courses. So it might take a little bit of time to gather these transcripts, so I encourage you to get started on that as soon as possible. We do have a 600-word personal statement, which is your opportunity to tell us why you're interested in the Payne Fellowship, why you're interested in a career in the Foreign Service, specifically with USAID, and how the Payne Fellowship is the next logical step in your path to become a Foreign Service officer. So there's a lot of things to tackle there, and there's plenty of ways for you to frame it, for you to go about telling your story. But ultimately, we want to know who you are, why you're passionate in the Foreign Service, and what makes you set apart and stand out to be a candidate for the fellowship program. There is a component of financial need that is evaluated in the application. And for that, we're of course going to ask for raw numbers generated from your FAFSA, as well as ask you to complete a 400-word statement of financial need. And these 400 words are to tell us the story behind the numbers. So what does financial need look like to you? How have you experienced that personally, right? And it's going to look a little bit different for a lot of different applicants. So some applicants might say, I worked during undergrad and I know I won't be able to work full-time during graduate school. Some applicants might say, I had family support me during undergrad, but they won't be supporting me for graduate school, or any certain way for you to let us know what we can't see in the numbers and to help demonstrate what that financial need looks like to you personally. We do ask for 2 letters of recommendation. The first of which traditionally comes from a faculty member, someone who has seen you produce work. So what I'm talking about when I say produce work, we're looking at readiness for graduate school. Writing skills is something we really like to see a recommended focus on. Your second letter of recommendation is from what we call a community leader. And a good way to understand this is somebody who can speak about your ability to do work. They sound quite similar, producing work and doing work, but those are 2 separate sides of you. So someone who can talk about writing skills, how you're prepared to go to graduate school, and someone who can talk about your commitment to service, maybe experiences you've had in community service projects or your work ethic, things like that. So although they sound very similar, I encourage you to think strategically about who might be good people to talk to you, talk about you from these 2 different perspectives. And then finally, anything you're proud of, any community experiences, volunteer experiences, we're going to give you the space to make sure that you're able to brag about yourself and tell us all the wonderful things that you have been able to do. Our eligibility requirements are quite simple. So you have to be a US citizen to apply. You must have a 3.2 GPA at the time of application. That is the minimum allowed. And you must be planning to enroll in a graduate program starting in the fall 2022 for this current application year. So going over the 4 different criteria we have for the graduate programs, it must be a 2-year graduate level program. It cannot be a PhD, a JD, or a program that's 3 semesters or 5 semesters. It has to be a 2-year program. It must be traditionally delivered in person, so no online programs. It must be relevant to a career in the foreign service and with USAID, and I'm going to go over what some of those might be for specifically for public health. And then finally, it must be based in the United States. So it cannot be like London School of Economics or any programs that is internationally based. Our application deadline this year is November 1st. So we're going to be selecting 30 finalists by December and interviewing those 30 finalists the second week of January typically is when we do our interviews. We're hoping that they're going to be in person, but COVID pending, they might be virtual. That's okay. We're going to make sure that you have your interviews as soon as possible, and you'll know at least by the 3rd week of January whether you're selected as a Payne Fellow. And this year we're going to be selecting 15 fellows, which is great. Our first cohort of 15 was selected last year, and we're super excited to have the continued growth of the Payne Fellowship program. So on to population health and nutrition. Internally, the backstop number that's assigned to this within USAID is backstop 50. So if we say backstop 50 or health officer, just know we're talking about the whole backstop itself. But as the name implies, you're going to be working primarily within the health sector. And that might mean you're working with maternal or child health. You might be working on HIV/AIDS or infectious diseases, including COVID-19. The backstop has been incredibly busy in these past 2 years, but we're super thankful for the amount of work they're putting in. You could be working on nutrition, environmental health. How is the education behind these programs? How are the economics behind these programs, right? There's a lot of different ways that you can find your own focus or your own niche within population health or nutrition. As a health officer within USAID, you're going to be identifying these priority assistance needs and where can best USAID use their resources, their funding, in order to address these needs within the host country. Specifically within this backstop, there is a lot of focus on co-creating and co-designing these programs to make sure that you're adequately addressing host country needs and, not coming in with a United States save everything mentality, but how can I best work with this host country in order to address their most prescient needs? So that's just a very brief overview over the population health and nutrition backstop. And over to a couple of the relevant graduate degrees that the Payne Fellowship will help fund in order to lead to this backstop. So we're going to fund degrees like international health, global health, shared, though they're obviously going to be great programs. Public health is great. Population studies, demography, medicine, these are all wonderful programs. And I can think of a few fellows who have done either public health programs or even more specific programs. So one of our 2021 fellows is doing community-oriented medicine, which falls under the medicine. We have a fellow who did an epidemiology program, right? So you're able to do as specific as you are interested in, as long as it's going to be preparing you for the health officer backstop. We will also look at any programs that are maybe a little bit more general, like international development, public administration, but they need to have a specific specialization in global health. So these programs, we're going to work with you to make sure that they're going to be approved by the agency to lead to this specific backstop. But just think that specifically within Backstop 50, population health and nutrition, any graduate program that you're interested in has to have a pretty significant focus on public health or a specific issue within public health. So with that sort of background on the backstop, the fellowship, and just a briefer or reminder of what the Payne Fellowship offers, I'm going to go ahead and hand it off to 3 Payne Fellows, Payne alumni rather, who have graciously offered their expertise and their experience within this realm and have asked or have been willing to share their own stories of how they become a Payne Fellow and what brought them to the Payne Fellowship. So I'm going to go in order of who they are on the slide. So Berhan, if you are able to introduce yourself and get us started.
Hi everyone. I hope you can hear me. There might be a bit of a lag, but so I'm just going to introduce myself and you'll see me, and then I'll turn my camera off. So just to make sure that bandwidth issues don't interrupt flow. But as Christian said, my name is Berhan Hagos, and I am a very proud Payne alumni from the 2015 cohort. So back when we were a really small program, there was 5 of us that year. And I'm currently a Foreign Service officer as of 2017, and I'm in my second tour. So I'm now based in Maputo, Mozambique. And so greetings from Maputo. It's nighttime here, so if you notice that it's dark, that's why. But I'm really happy to be here with you all this afternoon and to share a little bit about my experience as a Payne Fellow and why this fellowship was the right fit for me and could be the right fit for you as well. So I'm going to turn my camera off now. But so in terms of my story and kind of my trajectory, for me, when I was in undergrad, I think like many people who end up in public health, I started as pre-med, and I stayed in pre-med for a little too long, I think. So I was pre-med for almost 3 years, but in doing that coursework, I recognized that I didn't want to be a physician, but B, that I was very much interested in health sciences and in working with communities as it relates to health outcomes. So I knew that pretty definitively my senior year of college, that I wanted to go into public health, but there were kind of 2 big things that I considered to be obstacles at that moment. The first was that a lot of the positions that I was looking at, like jobs, essentially, being a senior in college, I found very interesting positions, but I noticed that most of them had a minimum requirement of a master's in public health. So that was like, I was like, oh gosh, so I need to go to school, and it needs to be sooner than I thought. And then the other kind of concern that I had was like, okay, I was just coming out of 4 years at a private institution, so I was thinking through the finances of like, how do I make a graduate program accessible to me at this point in time? And when I was thinking through those 2 kind of concrete challenges I had, I started reaching out to a lot of different mentors to see what folks had done in the past who were interested in public health degrees. And one of my mentors actually suggested the Payne Fellowship. And so that's how I found out about the program. And that's how I found out about the Foreign Service. I had no idea such a career existed. I was like, what? Someone is gonna A, support my graduate education, and B, I get to work in communities across the world, addressing issues that are not necessarily common domestically, for example. So I was that really piqued my interest right off the bat. So I applied for the Payne Fellowship, and unfortunately that year I did not get the fellowship. So I'm one of those people that recommends that you try and try again until you succeed. So I did apply, and I was an alternate that year. But one thing I did do is I took note of what my colleagues had done at that point in terms of the people that I interviewed with. I was thinking, okay, like what is it that they had done up till that point that was a potential like area of improvement for me. And for me, I think what I noticed was that a lot of the folks that I interviewed with that day had work experience overseas. So I committed to figuring out how to get that kind of experience as well. So I applied for the Princeton in Africa Fellowship, and I was successful, and I got a placement in Botswana, working at a school doing a lot of program management work. So I did that for a year. I also did a critical language scholarship in Morocco, studying Arabic, which was a language I'd been studying in undergrad. So it was helpful to have like that continuation of that experience. And then I applied again. And at that time, that second try was the charm for me. And that's when I was able to pursue my master's in public health. And I did go the route of pursuing an MPH, and my specialization within my MPH was socio-medical sciences, which is essentially studying what are the implications of policies, of the environment, et cetera, of race, of economics on health outcomes, because that was something that was really important to me. But at the same time, Columbia has a core curriculum, so you also had to take courses in epidemiology. You also had to take courses in infectious disease, malaria, et cetera, which I actually really encourage, because now that I'm almost 5 years into my foreign service career, I'm learning that being a foreign service health officer is actually quite a generalist position, in that as you move from country to country, what you're working on changes pretty dramatically. So my previous assignment was the Philippines. So I spent 2 years in Manila. And when I was living and working in Manila, the core of my responsibilities were around health systems financing. So that was very different from what I had pursued in my MPH, or while doing my MPH. But I think there's also just a lot of opportunities as a health officer to continue to expand your knowledge base and technical areas. So you can actually pick your foreign service assignments based on technical areas within the health field that you're interested in learning more about, right? So that's like another, I'm kind of jumping a little bit all over the place, but I wanted to make sure that that point is clear, is that as a health officer, from my experience, it's more of a generalist job, and that it's really important in your graduate degree to make sure that you're covering a lot of your bases across the health sciences field, so that when you arrive in the foreign service and you're assigned to whatever job in whatever country you'll be sent to, that you have a little bit of knowledge about family planning, that you have a little bit of knowledge of maternal and child health, because it's possible that that's what you're going to be responsible for working in. So that's just my plug for being a little bit more of a generalist than not. But I'm going to just, I think I'll stop there, and I can answer specific questions anyone might have about health system financing, about HIV and AIDS work, someone's interested in infectious disease, or what it was like living in the Philippines, and what it's been like in Mozambique. Back to you, Christian.
Great, thank you. So let's go ahead and pivot over to Naisha, who can tell a little bit more about her story.
Thanks, Christian, and thanks, Burhan. Fun fact, as you can see from my picture, I'm also going to Mozambique. So my name is Naisha Ford. I'm a 2019 Payne Fellow. I've been a Foreign Service Officer for a shorter time. So I just kind of joined the agency as a Foreign Service Officer in June of this year. But most recently, as you'll learn with the Foreign Service, I got my first assignment, which is a directed assignment, and I'll be going to Mozambique. So me and Burhan will be together for a couple of years. But similar to her journey, when I joined undergrad, I actually was also interested in pre-med. So a lot of my experiences were focused around that. I did a lot of like shadowing of like doctors. I did some internships with like medical facilities. I engaged in like a lot of community service. And it was actually the community service that took me abroad. So my school had study abroad program like a lot of undergrads, but then they also had short-term experiences. So this would be like about a month for people to, you know, who couldn't usually do the traditional study abroad, to go abroad and do work. So I took advantage of that. I was a biochemistry major in undergrad, so it was really hard for me to plan around all the science classes that had labs to do like a 6-month trip abroad. So what I ended up doing was just a series of small study abroads, and then some also during the summer. So a lot of the small study abroads would take place during like the breaks. And that was really my first experience with working abroad. So I ended up going to the Dominican Republic, and I went to Peru, and I got to work in like the health systems there, and I really, really liked it. So when I graduated, I realized that I did not want to go into medical school like I originally thought I did. And I ended up going into the Peace Corps. So I did the Peace Corps in Rwanda. I was a maternal and child health volunteer, working mostly on maternal and child health, within that nutrition. And then I also did malaria work, because I really liked, like parasites and infectious diseases and things like that. So it was actually while I was in the Peace Corps that I also kind of learned about the Foreign Service. I had no idea what the Foreign Service was, or really like dived into international development as an undergrad. So it wasn't until I joined the Peace Corps that I realized like this whole world as far as health existed. And it was as I was transitioning out of Peace Corps that I realized I really liked doing this work. I realized I did not want to go into medical school. If I could, I would have been like a forever Peace Corps volunteer, which some people say they would do if they paid more money. But I realized I couldn't do that. So I just looked into opportunities where I could still do that type of work. And it was actually a friend of mine who sent me the link to the Payne Fellowship and was like, I think you would be like really good at this. So I did that. I was also applying to graduate school at the same time because like Burhan, I realized that a lot of the work I wanted to do, I couldn't do without kind of getting a master's degree. So it was actually while I was applying to my master's program that I also found the Payne Fellowship. And I applied. I flew all the way from Rwanda to do the interview in DC. Yes, it was a long flight, but it was great. And I was very like blessed to be able to get the Payne Fellowship after my first try and interview. So kind of going off of my experience in Rwanda, that's, I really wanted to get my master's in public health in something that had to do with infectious disease. I really liked working with people on malaria, and just like all of the other kind of like GI parasites that you see. And that was kind of one of the biggest reasons I chose Tulane as my as my graduate degree. Kind of like I said, I'm a relatively new Foreign Service officer. So if you have any questions about like what it's like to transition from graduate school into USAID, I am doing it during a pandemic. So that's a little bit different than maybe what it will be like when you do it, but happy to answer any questions. Passing back to you, Christian.
Great, thank you. And finally, Emma, if you want to share a little bit more about your story.
Thanks, Christian. Okay, I can't see myself on video, so hopefully I'm well placed. Similar to Burhan, I am overseas. I'm currently in Kinshasa in the DRC. I'm on my second tour as a health officer. I was previously in Senegal for 4 years. So I am one of the guinea pigs, I like to joke, of the Payne Fellowship, because we were the first group cohort. So the first Payne Fellow was selected in 2013. And then 2014 was really where they were like, oh, let's try a group thing, see how it works. And so I will leave maybe application questions to the other two, since I am sure it has changed a lot with the feedback that we provided. But now that I've been in the Foreign Service, so I'm at the beginning of my 6th year, so I can comment a lot on what it means to be a health officer and what it's like once you've transitioned out of being the fellow or the grad student or the new health officer. So why the Payne Fellowship? I think similar to the other ladies, I too arrived at UNC thinking I'd be pre-med, but I realized within my first year, I would say that it was not for me. I spent the first summer after my the first summer of college, I was in Rwanda actually working in a rural hospital. And at the time I was still thinking pre-med. My mother was a doctor. And I think it hit me, right, that there are so many people who, one, couldn't access the hospital in the rural area I was working. And two, if they did access it, they came well after their symptoms or their condition were really serious, because going to access health meant not feeding their family, not earning an income that day, like days of travel potentially. And that's when I think, rather than feeling burnt out, I started asking myself, how do we address more of that context and those factors that prevent people from being able to access quality health? And that's when I discovered public health. UNC, fortunately, this is before Obamacare, so public health was not yet popular. There weren't a ton of people who wanted to be public health majors. And I was fortunate that UNC actually had an undergraduate public health program. So I applied and became a public health major. And so I pretty much spent every summer of college, either overseas or domestically, working on health issues, health access issues. And so when I finished college, so the Payne didn't exist, I went overseas and did a Fulbright in Colombia. And then the Obamacare had just passed basically my last year of college. And so after my year in Colombia, I was torn between staying overseas, because I truly loved living overseas and working with communities, versus being back in the US for this historic moment. And I chose not to miss out on history. So I moved to DC without a job. Thankfully, I found one pretty quickly. And I worked for the American Public Health Association in their policy center. And that was great, because it really, kind of what Burhan was saying, where as a health officer, you're expected to be a generalist and have a breadth of knowledge. My job with this policy center was to cover a lot of different public health topics, everything from environmental health to the built environment to Medicare, Medicaid, you name it. And so what it made me realize after working there for 2 years was that, without a doubt, I needed a job where I wouldn't feel stagnant and could be constantly challenged and learning new things. I really enjoyed that the topics varied, but I think it also reinforced that, as much as I was happy to have been in DC and part of implementing the Affordable Care Act, I really missed the international work. And there are a lot of problems domestically that equally, I think you could apply the work that we do overseas to within our country. But I think, as the child of immigrants, so I was actually born in Cameroon and my family immigrated when I was 2. I think it's just always been a part of me to want to work in developing countries and reduce those gaps we see in access to healthcare. So after 2 years, I was in a similar position of, okay, I would like to not start back at zero on the career ladder, but if I transitioned to the international kind of like development and health space, I'd have to start over because I didn't have my MPH. And so I was looking at grad school programs and trying to figure out, did I want to just move overseas and work directly for one of USAID's kind of like typical implementing partners, or go to grad school? What was next? And it was actually really serendipitous that I found out about the Payne, especially because it was just starting out and communication about it at that point was pretty much word of mouth. So I happened to be presenting at Howard University on a panel. We were presenting to college students about post-grad fellowships, and I was representing the Fulbright. And the Payne was not presented during that panel because it was so new. But one of the other panelists happened to be affiliated with the Bunch Center and like knew what was happening with the Payne. And so when the event was over, he pulled me to the side and was like, I know you didn't mention that you were seeking a fellowship, but I actually think you should apply for this new fellowship because it would be a great fit. And that was basically the beginning of this beautiful journey. And I think similar to what everyone is thinking, right? It's an incredible opportunity to have grad school paid for, to have these summer experiences. And for me, the foreign service actually did align with where I saw myself going in the future. Rather than having to move overseas, try and find an NGO job and figure it out on my own, I saw it as kind of a direct path. And I'd found out about USAID during those summers when I was working overseas during college in the health space. And I'd always seen USAID as my end goal. Not necessarily something that I was actively working towards, but to me, it was always, like to work for USAID, you have to be really old or like have white hair. So I never like truly realized that they were looking for younger health officers, that they were trying to diversify the workforce. And so that's how I entered aid. I worked on the Hill for Congresswoman Barbara Lee for that first summer. And then the second summer, which was my practicum for my MPH, I was with the USAID mission in Cambodia. Both of those were phenomenal experiences. And yeah, I joined the Foreign Service in 2016. So in terms of tips, because I don't want to talk for too long, I would just say that now that I've been a health officer for, I guess, a little over 5 years, I think when I look back at grad school, I would just note, one, regardless of whether you take this fellowship or not, definitely go into grad school knowing what you want to get out of it. That would be my advice across the board. Grad school is very different from undergrad, where undergrad's all about learning and just being curious and absorbing. Whereas for grad school, I actually felt very fortunate that I knew I had this USA job that was waiting for me, because it allowed me to be more targeted and kind of evaluate opportunities better and seek out opportunities better. And I have great friends from grad school who, like, at the time when I went to grad school, their approach was maybe more of the, like, just absorb, curious, I don't know what I want to do next with my life. This will buy me time. And while they did enjoy grad school, I would say their experience was different. I think they left maybe a little more dissatisfied. And so once again, everyone has different experiences, but I think in talking to a variety of friends, even outside of the fellowship, just professionally, think of grad school as the beginning of you building your network. So that would be my first tip. And incredibly, right, as I've now work in different countries, it really is your first big professional network. So people reach out through the graduate school alumni network, or I'll be in meetings with other fellows or alumni of my MPH, and it creates work bonds. So that's great. I think two, as Burhan said, when you join USAID, you will be a generalist. So definitely try and, like, you can have a specialty. Like, I love maternal and child health. I love health systems. So I definitely took a lot of classes in those areas, but also think about what you don't know and try and take classes that will really strengthen those weaker kind of knowledge areas. And then lastly, maybe my last grad school tip would be, let me look at my notes. Oh, yes. So as a technical officer, you will have
We might be having just a little bit of bandwidth issues there, but I'm hoping it comes back soon. And if not, we can, Emma, are you good for feedback?
Sorry, internet struggles. Can you all hear me?
Now we can, yeah.
Okay, I'll turn off my video in case that was a useful tip. But yeah, my last tip for grad school is just going to be, that I encourage you to seek out hard skills. So you can always learn more of the cutting edge knowledge in whatever technical area. And like, don't take this to mean don't seek out technical information, but really think about those hard skills such as monitoring and evaluation, or the quant side, or even managing people. Because I think that is what will truly translate. And what I've seen in working with lots of different health officers over the years is that the difference between a great health officer and like a fine health officer are ones who can think big picture, be strategic, have an understanding of the number side, not just the kind of technical, softer side, and can manage people. Okay, that's it from me.
Awesome. Great. Well, thank you all for sharing your journey thus far throughout and to the Payne Fellowship. We're going to go ahead and transition to the Q&A. And again, you're welcome to type in your question or use the raise hand function on Zoom and ask your question vocally. We already have a few questions that we can get started on. I'm not sure if this one applies to any of y'all, but Anne is interested in finding out if any of these episodes have families and how they feel supported as a Foreign Service officer, or a parent, or as a child of a Foreign Service officer. So if that applies to you all, feel free to handle that. And if not, she did have another question regarding language training and how that had went about.
I can take the first one if others want to take the second one. So I don't have any kids, but I am overseas with a partner who is not American, and we are not married. So even though I don't have kids, I have had to navigate this kind of State Department system of having a family overseas. And I would say that the level of support you get overseas depends on the country. Now that I'm in my second country, I can recognize and appreciate those differences when you're in a place that has more support. But I would say that in terms of kids, so if you have formal family members, whether it's a spouse or kids, there are actually a ton of benefits and a lot of support that is provided. So it's built into the kind of Foreign Service benefits and regulations that your child's education will be paid for. So you get I believe it's $20,000 a year to enroll your child in international schools. So a lot of Foreign Service officers put their kids in international schools overseas. A lot of people with kids also will pick posts based on the schooling that's available. So there's a lot of resources available that tell you, like, this is the level of schooling and the kind of accreditation and reviews of those schools that Foreign Service officers have shared. There's Facebook groups specifically for Foreign Service officers with kids or families. So in terms of support, I would actually say if you have formal family members, there's a lot there. The State Department even has a whole organization that's focused around facilitating life for Foreign Service officer families. Where it gets more complicated is if you have family members who are not quote unquote official. So if it's not a direct kind of like blood relative or a spouse that you are married to, the benefits are drastically limited, and you have to basically seek approval to have them be with you overseas. So it didn't sound like from the question that was where this question was going. So I'll just leave it at the formal family members. And this includes parents, siblings, kids, anyone that's a blood relative or a spouse. As long as they are dependent, qualify for benefits. And that includes trips outside of the country, schooling. Your housing size is determined based on the number of official family members. You can even request certain types of housing if you have family members with needs. And if you have any family members with learning disabilities, et cetera, there's really a lot of support out there. Over.
Yeah, I just wanted to chime in here really quick and kind of help answer the second question. Again, I can't provide much help because I have not yet taken language. So, Burhan or Emma, please feel free to like chime in about your experience at taking language. But yes, from my understanding, the FSI language is the same as the State Department. And just looking at the second question in the chat, again, Emma and Burhan, I'm just going to let you kind of chime in on that one as well.
Yeah, I can add to what you just shared in terms of the language training is provided by FSI. So when you do language, you'll get to take those courses with your State Department colleagues, which is a really nice opportunity for kind of expanding your network across the Foreign Service. But USAID does have options to not take language courses with FSI for whatever that reason might be. Like maybe you're the only person studying a specific language, so they suggest that you take it with an independent contractor. So that does happen. It's not uncommon, but yeah, FSI is definitely the institute that provides language. And then to Jasmine's question about how hands-on is the role of a health officer, that that was one of my biggest learning curves as well. When I started in the Foreign Service, I did expect to spend a lot more time doing what I would categorize as like implementing your activities, like whatever the work is that that is being done in country. But what I've come to understand is that the health officer role in many ways is a management role, in that USAID is not directly implementing any activities. The way kind of the business model for USAID works is that we create what we call contracts or cooperative agreements. That is an understanding between the U.S. government and an independent entity. So like a really common one in the health space is like, for example, like FHI 360. And they are the FHI 360 is like who is responsible for actually doing the work at whatever site, right? At whatever community. And our responsibility as health officers is to oversee that work. So to have regular communication with the staff and the team that are with, in this example, FHI 360, that are responsible for doing the day-to-day work. So in response to your question of how much time do I spend in communities versus at my desk, I would say for me in the past 5 years, I would say like 95% of my time is spent inside the USAID office. There are definitely a lot of opportunities pre-COVID to do in-person visits to a lot of the places where we had activities, but that isn't the day-to-day work. And I think the more time you spend in the agency, the less time you have to actually be doing the site visits. So that is something to note. So if you're really somebody who's like who wants to be a technical expert and who wants to spend a lot of their time doing project implementation, that's not commonly the health officer role. Emma, please feel free to contradict with your experience, but that's been my experience so far. Over.
Sorry, I was having slight technical difficulties. So yes, I don't have anything to contradict Burhan, but maybe to share a little more. So I think the number one thing to know about USAID is that there is not one experience. The experience changes country to country. So I was previously in Dakar, where you can travel throughout the country of Senegal quite easily. And I would say that I was getting out to the field at least once every 2 months, probably. I'm currently in Kinshasa, DRC, which is an enormous country that lacks a lot of physical infrastructure. And so to do site visits, you have to take a plane. There's no driving to do site visits. And so here, the guidance I've been given is that we are encouraged to get out to the field. And as long as we can plan a trip, we can go. But because it's logistically more complicated. And so even though there's this kind of like free, please do get out there, realistically, I would say people probably get out once a quarter. In COVID times, most recently, it's probably been once every 6 months. That said, 100% agree with Burhan that if you want this job because you want to be the technical implementer, it's the wrong role. And this is where I was saying I kind of saw USAID as my end goal, and originally thought I'd be with an NGO overseas first, in the field, interacting with beneficiaries all the time, really making that change at the operational level. It's not that. You are a program manager. However, there's a lot of cool aspects that come with being a major donor that I hadn't fully appreciated until I was in this role. So while you aren't the implementer out in the community, you are at a table with the Minister of Health, with the key decision makers for your country. And USAID in most developing countries is one of the biggest contributors to the health budget. So there's also a lot of technical leadership and input that we are invited to provide. And so I would argue that even though you're not at the operational level, you're still playing a very influential role in what is happening in these countries. And the other thing that I wanted to add is, so USAID's vision moving forward is to increasingly give money to local organizations, but also to increasingly cut out, if you want to think of international NGOs as the middleman, cut out the middleman. And in countries that have less corruption and stronger financial management systems, give money directly to the government. And that's a big change, because what that means is that you're actually not just a project manager for a bunch of organizations, but you are a lot more technically involved and getting out to the field more often. So Senegal was one of the countries that's approved to do these agreements, which we call G2G, government to government. And so every year we gave about $8 million to the government of DRC at both the national level, the regional level, and the district level. And so there, right, like we're together with our government counterparts, looking at indicators, going out to the field, scaling up programming. Because it's new, there's a lot more opportunity to get involved at the operational level with those kind of traditional donor implementing partner relationships that Burhan mentioned. That's where you probably get out to the field a lot less, or less technically engaged, and you're just monitoring performance, course correcting, et cetera, as needed. That said, when disasters happen or crises happen or outbreaks happen, it is all hands on deck. And so, for example, when I was based in Senegal, there was an Ebola outbreak in Guinea in March. It started in February. And I went to Guinea for a month. So even though, yes, I'm technically a program manager, I was in Conakry attending these emergency operations meeting, providing insight and kind of helping coordinate, identifying where gaps are and where USAID would have a comparative advantage in terms of funding and activity interventions. Here in DRC, we currently have an Ebola outbreak, a measles outbreak, a meningitis outbreak. So it's a reframing of what it means to be involved, but you're definitely involved a lot. For FSI, I don't have much to say because I tested out of French, but I will say that being paid to learn a language was one of the top reasons I wanted to become a foreign service officer. There are not many jobs where you're paid to learn a language. Generally, if you're starting from zero, it's expected for Romance languages that it'll take 6 months, and you don't have any additional responsibilities, 100% full-time. Your job is to learn a language. Over.
Great, thank you. I see we have one hand raised. So Varun, or hopefully I pronounced that right, would you like to ask your question?
Yeah, thanks so much, Christian. And thank you, Baran, Nisha, and Emma. It was so really wonderful to hear your backgrounds, your motivation, and also your experiences throughout the program. So I have so much I really want to ask you and learn from you, but I think I'll limit myself to one question and maybe have the others ask and probably leave mine to the end. So is it okay if I turn my video off? I think I'll have net issues as well.
Yeah, sure.
Yeah. So my question is for Burhan and Emma that you spent almost 5 years with the Foreign Service and you've done 2 tours. Can you talk a little bit about your career growth in these 5 years? So was it that you supported projects in your first tour and then you got to lead projects in your second tour? So did you get higher responsibility? How does that sort of work?
I can, Varun, thank you for your question. I can start to respond to that, and I'll ask Emma to add her experiences. So there is a lot of I think in general there's a lot of opportunity for professional growth within the Foreign Service, especially the health backstop, because it's one of the largest backstops. We have a lot of offices around the world. The Global Health Bureau is also just pretty massive, and I think in terms of what professional development looks like for you as an individual, you have a lot of I think a lot of power in crafting that. So I think if you are really interested in the management track versus like being a really technical officer, you can pick or bid, I should say, on your next assignment based on those those criteria. So for me, when you're in your first tour, that's really a learning tour, right? So you get a lot of opportunities to work with people who are very senior, and you learn the USAID processes. That's what you really do the first 2 years. It's a lot of just understanding how USAID works from a programming perspective. And then depending on kind of the circumstances, you'll get different opportunities to be a program manager or an activity manager. And that is kind of like the bread and butter of what USAID does, or health officers do, really. And then there's like the added responsibility of supervision. Like there might be people that you are responsible for supervising, and just, you might sit on technical working groups that have representatives, I should say, from like different agencies, like multilateral agencies. So that's like another way to kind of grow your profile. And then when you bid on your next assignment, you can bid on positions. There's going to be like lots of positions that are available, and you can bid on a position that perhaps has higher management responsibility, because that's something you're really interested in strengthening, like as a kind of a personal skill set. So I chose to bid on Mozambique because it is the largest health office that USAID has. We're a team of 70 people, and it's also a really large portfolio in terms of funding. We have about an annual budget of almost 300 million. So there's a lot of different activities, different technical areas that are covered in Mozambique. And for me personally, I was like, oh, this is going to be a great opportunity to work across all of the different technical areas that the Global Health has, because the Global Health Bureau has, because they all exist in Mozambique, which was a very different experience than my first tour in the Philippines, which is a much smaller office and a much smaller portfolio. So you do have, I feel like you have a lot of flexibility around what professional development looks like for you and what you want to prioritize, like what areas that you want more exposure in, or you want to just focus on. Yeah, I'll leave it at that and pass the mic over.
Thanks, Burhan. So yeah, I think she nailed it. It's really, I see this career as a choose your own adventure, both in terms of geographically, but also technically and professional development growth. So each country is a different profile, and therefore the skills you'll develop and the experiences you have are different. And so the way it works, I don't know if everyone's familiar with bidding, but when you've finished your tour in a country, the year before it ends, you receive a list, and it's called the bid list. And that's a list of all of the positions globally that will have a vacancy the next year. And those are positions that you're eligible to bid on. So it works similar to med school matching, where both you and those missions who have open positions are bidding, and you rank your preferences 1 through 8, and then that matching happens. And there are certain requirements for positions that you have to bid on, but based on the experience you already had, and it's not just people don't only bid based on professional development. They will also bid based on their family needs, personal needs, etc. But from the professional development angle, what's nice is you get a description of what the position is, and then you'll have calls with people on that team to better understand what it means, what's needed. And then you can tailor what you want your next step or your future to be based on what you want. And so for me personally in Senegal, key differences between that first tour and the second tour. So in Senegal, I was informally supervising 2 people. In DRC, I'm officially supervising 6 people. The team I manage is 3 times the size. So in Dakar, you shouldn't assume that just because you're a first tour officer, you won't have responsibility. So I managed a $10 million contract during my first tour. And now, because I was looking for more of those kind of management supervision experiences, I am not directly managing a contract, but I'm supporting the management of several. I think other key differences in terms of professional development. So in Senegal, I mentioned we had a government to government agreement. That was my portfolio. And what I loved about it was I could be so creative and innovative because it's newer to the agency. People are looking for like pilots and lessons learned. So there was a lot of freedom to do development the way that I thought it should be done and course correct along the way. But what I recognize is because it's a different type of way of doing business than USAID typically does, it is more niche within the agency. The reality is most developing countries do not have the financial management systems to qualify for government to government. So I was specifically looking for more traditional programming so I could understand and have a different perspective on how things work. So yeah, when I was bidding, I think those were my biggest, really, management. Also, I wanted more technical because government to government is not a technical health area. It's a way of doing business. So I worked with all of the different types of money that we have: malaria, family planning, nutrition, health system strength. Well, we don't have health system strengthening work, money, but that type of work. And what I appreciate about DRC is that I would be more technical. So I was so management heavy, strategy focused, vision in my first role, that for this role, for me, professional development was being more technical. Over.
Thank you so much. Thank you.
Great. Thank you, everyone. So I am aware that we're over time. So I'm not sure. I know we have one more question. Timothy, you have your hand raised. I'm not sure if Naisha, Burhan, or Emma have the time to stick around to answer this question.
I can stay online.
Okay, awesome. Great. Then Timothy, if you're able to ask your question, and then we'll have that be the last question of the session.
Awesome. Thank you so much. Let me pull my microphone here. Thank you, ladies, so much for your time. I really appreciate it. So, Burhan, you mentioned this earlier, and Emma, you may also be able to speak to this based on your knowledge and experience as well. So, I'm an entrepreneur in Tulsa, Oklahoma, which is historic Black Wall Street. I'm also a Howard University alum, and I own a grant writing and fundraising consulting firm. And essentially, as I've mentioned to Christian, one of my motivations for doing working with USAID is because I get hit up so often from internationals, many from Africa and Latin America, asking for assistance with fundraising and development and building entrepreneurial capacity. So, Burhan, you mentioned that medical financing, I don't know the specific verbiage exactly, I don't recall the full verbiage, but I wanted to ask you, is there room for grant writing and that sort of experience in the medical side? Because from my understanding, and again, this is why I'm asking, that would be more for, I guess, a development officer per se, as far as the different career tracks or officer tracks that USAID offers. So I wanted to ask you all that because I am interested in looking at the different options as far as being able to provide ultimately assistance to help those folks who are overseas build and scale.
Thank you for that question, Timothy. So I was speaking about health systems financing work, and in the Philippines, we were doing that work at the level of the Ministry of Health. So essentially, in the Philippines, the government had passed a law that basically instituted universal health care, meaning that every Filipino had the right to seek health care and receive that service at no cost to them. And so the work that we were doing as USAID was we were supporting the government in thinking through how to finance a national health insurance scheme. So it was more on the level of from an actuary perspective, what does that actually look like? What kind of tax policies do you need to have in place to generate that kind of income? And then once you do have it, like how do the different components of the Ministry of Health work together to manage that kind of a budget? I think what you are describing is more of folks that are based in a specific country or community and are working on who have different businesses or are working in different clinics, etc., and they're seeking funding to be able to do kind of the day-to-day work of their organizations. Kind of that's what I understood. I understood from you. And in terms of how does USAID engage with local organizations, it goes back to what Emma was describing about the shift that USAID is in the process of doing from cutting out the middlemen, as Emma described, which are like the large international organizations, and working directly with local nonprofits or the government. And the way that works is that local organizations are able to respond to proposals that come out of, or requests for proposals that come out of USAID offices in, for example, in Mozambique. And there are different activities or initiatives that work with local organizations to increase their capacity for financial management, for example, so that they can be prepared. They would be prepared to receive U.S. government funding to be able to do specific types of work. So that is happening, I think, more frequently than not. But in terms of you as an officer, like how much you get to interact with that type of work, I think it's increasing in the health backstop, just because I know, for example, in all of our PEPFAR programming, there is a huge drive to work with local organizations. So that means working on capacity building. And then for grant writing specifically, what we do is more reviewing. We review a lot of applications, proposals that come in, and that the office that is, or the Backstop, I should say, that does that as their kind of like core work are contracting officers. So the Office of Assistance and Acquisition, and I can't remember the Backstop number, but they're the ones that do that, the work of reviewing contracts and cooperative agreements and different proposals, like on the day-to-day. That's the Backstop that would be doing that. I'll leave it at that and ask Emma to add. Over.
Yeah. So as Burhan said, as a health officer or any technical officer for USAID, you'll be primarily on the side of reviewing quote unquote grants. They're actually proposals for funding. And there's two avenues. So the main one, which is what Burhan mentioned, you as a health officer will create solicitations and design what you would like to see implemented by others. And so you're involved in the design of what programs should exist, and then reviewing proposals that come in. And then the second avenue, which has historically been smaller, but because of this agency push towards funding more local organizations, increasingly we're receiving what are called unsolicited proposals. And that means USAID didn't put out a request for proposals, but a local organization working somewhere has said, we have this capacity and we see a need where we are. Here's how we're proposing to address the challenge and are seeking financial support from USAID. So you would also review those unsolicited proposals for their merit. So contracting officers are very kind of legal contract heavy. I would say based on what you were describing, I think that a technical backstop would probably be more aligned with your interests, only because I have, like, my friends who are contract officers are not going out into communities doing grant writing workshops. In general, USAID is not doing grant writing workshops, but we are funding projects, as Burhan said, to build local capacity of organizations or make the application process more inclusive to local organizations. Local being those in the countries that we work in. Maybe the one other thing that I would mention is that I think that there are opportunities. So as a foreign service officer, right, you're working overseas, but a lot of people will volunteer outside of work hours. So depending on where you are, there's definitely opportunities to volunteer and to work with local organizations outside of your official USAID capacity. Over.
Thank you so much, ladies, for that. And I apologize for my daughter's room. It's a little messy here, but I have to find a quiet place when you have a house full of women that dominate.
Awesome. Well, thank you so much for all the advice, expertise that you've lended Emma, Burhan, and Naisha, who had to drop off a little bit earlier. We're going to go ahead and close out the session, but I did want to plug in something Naisha put in the chat, which is the Payne Alumni Developed Prospective Applicant Handbook. That can be found on our website on the resources page. It's going to provide a wealth of information regarding the application process, things to consider, as well as give you a sneak peek over the journey and the life of a Payne Fellow. So thank you so much for joining us. I'm going to go ahead and stop the recording now and then close out the Zoom.